My name is Dr. Mohammed Hidayat Greenfield, and I'm the elected Regional Secretary of the IUF in the Asia-Pacific region. The IUF is a global union federation made up of 10 million members in 126 countries around the world. I'm responsible for our members in 21 countries, including yours. Our team in the Asia-Pacific region has been doing a lot of work to keep our members safe in this pandemic and to protect them from COVID-19 through fighting for a safe workplace and maintaining very good hygiene and safety ourselves, maintaining wearing masks, physical distancing, washing our hands with soap, using hand sanitizer. These are all the things that really help in fighting this coronavirus. Today I want to talk about one aspect of this, which is a symptom, one of the symptoms people may have if they have COVID-19, which is the loss of smell. Now we understand that if someone has COVID-19, the loss of smell is one of the symptoms they might have. Just like fever and other influenza-like symptoms, flu-like symptoms, like sore throat and coughing, may be symptoms of COVID-19. Now, the first thing to understand is that for some people, they show no symptoms at all. So they can have COVID-19, be infectious to other people, pass on the coronavirus to others, but themselves have no fever, no sore throat, and they can smell just fine. So I think it's important, first of all, to understand that these people who are asymptomatic, show no symptoms, are not immune. They have the disease. It just affects them differently. They can pass it on to others, so they're not immune. In fact, it's very risky and very dangerous because you really don't feel sick and don't think to get checked for COVID-19. You don't think you need to be tested. That actually is much higher risk because you could be spreading it to others, including your family members. So that's about asymptomatic, not showing symptoms. In terms of one particular symptom, loss of smell, it's important to understand that really only about 30% of people who have COVID-19 lose their sense of smell. That means 3 out of 10 people. So if 10 people have COVID-19, maybe 3 have lost their sense of smell, but the other 7 people can still smell, but they have COVID-19 and it's still infectious and still infecting others, and may have other symptoms like fever or no symptoms at all. So it's very important that we're very careful about this information about loss of smell. Yes, it's one indicator, one symptom, but it's not the only one. So if, for example, people can smell, and you can check your smelling and think, I can smell just fine, it doesn't mean you don't have COVID-19. You still have to check other symptoms, and also it's about who you've been in contact with. So if you've been in close contact with someone who's suspected to have COVID-19, you need to be tested. If someone in your area, in your factory, in your department has COVID-19, and you're in what's considered the primary contact group or the secondary contact group, you need to be tested, because maybe you got it from someone who was in contact with them. Okay? So even if you don't have the fever, even if you have your sense of smell, you probably still need to get tested. So it's very important now that we understand with this disease, it shows itself in very different ways in different people. Okay? It affects some people more than others. The important thing is the only way to stop this disease spreading is that we follow good practices and are very careful. Go for the testing if there's any reason to be in a first contact group or second contact group or to have symptoms. But let's be very careful not to think just because we don't have the symptoms, just because we can smell, that we don't have COVID-19, because that's a higher risk. We're very confident we walk around and maybe spreading it, and maybe spreading it to our co-workers at work, to other union members, and to our family members, and that's not a good thing at all. Okay? So let's really collectively together, through our solidarity, keep safe. Let's take care of each other, not just ourselves. Wear the mask, always wash your hands, keep your distance, take care of others, and let's be vigilant. And always look to your union, working with the IUF team for more information, and we'll keep you updated. Thank you very much.